So I'd like to update you on the situation involving Hantavirus on a cruise ship that is currently stationed off the coast of Cabo Verde in the Atlantic Ocean. As of today, 7 individuals of the 147 passengers and crew have been reported ill. Sadly, 3 have died. 1 patient is in intensive care in South Africa, although we understand that this patient is improving, while 2 patients are still on board the ship and are being prepared for medical evacuation to the Netherlands for treatment. In our disease outbreak news that we published late last night, we did mention a 3rd suspected case who reported a mild fever at one point, and that would make this the total of 7 cases, 2 confirmed and 5 suspected. This person, I'm happy to say, is currently doing well and is asymptomatic. So typically when we have these ongoing investigations, our case numbers will change. They'll go up or they'll go down. So we will update you as necessary. At this stage, there are no additional symptomatic people on board. That said, the situation is being closely monitored, and as a precaution, passengers have been asked to remain in their cabins while disinfection and other public health measures are carried out. Medical teams from Cabo Verde are providing support on board the ship. Hantavirus infection was confirmed by laboratory tests in 2 of the patients by the National Institute for Communicable Diseases in South Africa, and further tests, including sequencing of the virus, is being conducted by NICD, as well as testing of the symptomatic patients on board, those 2 individuals, with the support from Institut Pasteur of Dakar in Senegal. Hantaviruses are viruses that are carried by some types of rodents. They can cause severe illness in humans, and they can be fatal. While we don't often hear about them, there are thousands of infections that are estimated to occur globally each year. People are usually infected through contact with infected rodents or their urine, their droppings, or their saliva. Human-to-human transmission is uncommon, though limited spread among close contacts has been observed in some previous outbreaks with one of the viruses, the Andes virus. WHO is working closely with authorities in Cabo Verde, the Netherlands, South Africa, Spain, the United Kingdom, and the ship's operators to coordinate actions to ensure the safety and health of all people on board, while also limiting further spread. WHO has informed all of our member states through our channels, our international health regulation channels. We are supporting the medical evacuation of the 2 sick patients who are stable on board, and we're coordinating with the Dutch and Cabo Verde authorities and the ship's operators. This is currently underway. Epidemiologic investigations are also underway to better understand the source of exposures of the suspected cases. Contact tracing is ongoing. Further laboratory testing continues. We are also coordinating information exchanges and actions across all of the member states that are involved. As you know, there are more than 20 nationalities represented by people that are on board. We are providing technical assistance. We're ensuring appropriate public health measures are in place on board. We are also conducting risk assessments and have released emergency funds for our contingency fund for emergencies to support immediate actions. Collaboration has really been excellent. I can't thank that enough. I thank all of the member states who have been involved, the NICD, the Institut Pasteur Dakar, the ministries. This is what WHO does. This is what we want to see happen in each of these outbreaks. So we're extremely grateful, and I don't apologize for thanking them, even though that's what they're meant to do. So thank you to everyone involved. Based on the current information and what we know about previous outbreaks, WHO assesses the overall risk to the public as low. We will continue to monitor the situation. We were actively engaged in working with countries, and we will provide any updates as necessary.